Sonia. Well, getting a good night's sleep is more important than you think. For people who suffer from sleep apnea, it can be a matter of life or death. Here with more and the warning signs to look out for. Welcome, registered sleep technician Brett Miller. Thank you for joining us. And first of all, let's talk about how important sleep is to our overall health.
Sure, Evan. Getting a good night's sleep, as we all know, is very important. It's difficult enough to exercise in the morning time. You're not sleeping well, then you're not really going to have that energy to want to get up and get out there and start a fitness routine.
Right, and being alert. I mean, just the simple tasks of maybe driving to work or when you're at work, you know, being productive, that all suffers when you're not getting good sleep, right?
That's correct. It's more than just a physical aspect that you're suffering from. It's definitely very mental. A lot of our patients have, depression and things like that associated with their sleep disorders. Yeah,
and we're talking about sleep apnea. Now, let's first of all clear that up a little bit for folks that might not be so clear on what that is.
Sure. It's very easy to say sleep apnea. You stop breathing. You're not breathing. Yeah. Typically what we see with obstructive sleep apnea is really it's just the airway. The airway itself is closing down at night while you're sleeping. That soft tissue is collapsing, and that's what causes the snoring, the upper airway resistance, the actual apnea itself, where no air is getting in and out of the body.
This is a very serious thing, too. This is not something that folks should take lightly. I mean, if your significant other is doing this throughout the night, this is a warning sign they should look out for, right?
Yeah, exactly. Severe snoring. A lot of husbands and wives refer their husbands and wives to the sleep lab. It affects their sleep as well. But restlessness, they're kicking around. You're just the snoring, the up and down throughout the night, maybe using the restroom a lot because the brain, the body is really not shutting down, really not getting into that deep sleep.
So then you got two people not getting enough sleep.
You got two people.
There you go. That's no good. Now we've got some equipment here, and let's talk about what you do in these sleep studies and what we have here today.
Right. So a sleep study involves coming to the sleep lab. We have a state-of-the-art facility, latest technology, as well as the rooms are very nice. They look a lot like hotel rooms. Very nice. This isn't a hospital experience. We want you to feel like you're at home in your own bed. Typically, we're testing for obstructive sleep apnea or just sleep apnea in general, and the treatment choices for that are really PAP therapy, so positive airway pressure therapy.
Okay, and that involves these kind of masks, and it looks like there's a lot to choose from, so there's probably something to fit everyone out there if they have an issue.
That's right, that's right. So there's different types of masks. There's masks that cover the nose and the mouth and allows the patient to breathe through their mouth more comfortably, typically associated with higher pressures.
Okay.
There's also a nasal mask, and that's just going to cover the nose, and then you also have nasal pillows, and that's just going to go in the nasal
And Brett,
openings.
This is something you would determine as far as what somebody needs from that sleep study.
Exactly. So they're going to come to the sleep lab and have a diagnostic. And essentially that's going to tell us, do they have sleep apnea and how severe it is. It's also going to tell us other things as well, but that's really what we're honing in on.
Okay, and some other warning signs are basically the tossing and the turning, the snoring. Is there anything else that folks should look for with their sleep?
Fatigue, excessive daytime sleepiness, as you mentioned earlier, kind of falling asleep during tasks, driving to work. We hear that a lot. There's certain comorbidities associated with sleep apnea, as you guys touched on earlier, cardiovascular disease, heart disease, obesity, drug-resistant hypertension.
Okay.
Any of those, if you have that in your medical chart as a disorder or a disease, you should probably have a sleep study done, or at least go see a sleep physician and have that consult.
Yeah, and I've done a lot of studies, and this one's pretty easy. You just kind of go to sleep.
Yeah,
you do all the work.
You're just coming to the sleep lab to sleep for the night.
And probably a room better than your own at home. So I like the sound of this. There you go.
There you go. And they are very nice. They're very nice rooms. All of our patients are always very, very happy with the experience.
Okay, if somebody out there says this is something I need to have my husband or my wife look into, how should they get in touch with you? Best way?
Sure. We just got our website up and running this week, lowcountrysleep.com. All of your viewers can go there. Our phone number as well is 843-820-5315.
There it is,
and
right there.
That'll take you directly to our office line.
All right, Brett Miller, thank you so much for stopping by and sharing all this with us. It's definitely something that could really help folks out, I'm sure.
Yeah, Evan, I really appreciate it. Thank you.
No problem. All right, well, stay with us after the break. We'll let you know about this weekend's Pet Expo. Yeah, the details coming up on that.